Thank you, Mike, and good afternoon, everyone. Today, Minnesota is reporting another 5,277 new cases and 43 deaths. On the case numbers, we'll talk about this further in the call, but some of those numbers for today do reflect the very large uptick in cases that we've seen that is affecting the case intake and verification process. Our pandemic totals now are at 831,669 lab-confirmed cases and 8,925 Minnesotans whose lives have been lost to COVID-19. There are currently 1,159 patients hospitalized for COVID, which is another record high day for the whole year, 2021. Including 257 patients in the ICU. Capacity remains tight, in fact, continues to tighten further for beds across the state. We now have 74% of Minnesotans age 12 and up who have received at least one vaccine dose, and 71% of the 12-plus population who completed their vaccine series. If we look at the entire vaccine-eligible Minnesota population, now down to 5 and up, we have 67% of the state who have received at least one dose. Before we go deeper into the briefing, we really want to talk some more about these extraordinarily high and concerning case and death numbers. We've been talking about the Delta wave since midsummer, but right now we find ourselves in a really, truly alarming spike in cases in more recent days. Our exhausted healthcare workers and our exhausted public health workers continue their truly heroic efforts to protect Minnesotans. But every day now, we're seeing dozens of Minnesotans dying from an illness that they didn't have to get. And that is beyond heartbreaking for all of us doing this work. The tragedy of this current spike in cases is that more than ever, we have the tools and the knowledge to minimize the impact of this virus. But a sizable number of people here in Minnesota and in other states are not using those tools. Some because they mistakenly think COVID is over or it's no big deal, or some because they're just tired of it, done with COVID, as we say, and some because they have fallen victim to misinformation. So many of these cases, especially the hospitalizations and deaths, could be prevented if more people used those tools, by which we mean vaccination, masking in public, staying home when sick, and all of those mitigations that have served us well over the last 2 years. Choosing not to use those tools has a cost. Sometimes it's a cost the individual pays themselves, but often it's a cost that that individual passes along to someone else around them or someone they will never know, unknowingly passing the virus. Particularly as we have talked so often about asymptomatic transmission. This spike is bad, it's scary, but it would be so much worse, especially with many, many more hospitalizations and deaths. It would be so much worse if it weren't for the fact that most Minnesotans now do have the protection of the vaccine. But many people, close to 40% of our state, are still not protected. We need all Minnesotans to recognize the fact that in a pandemic storm like this one, caused by the Delta variant, individual decisions have implications. Implications not only for the person, but for their families, their communities, and in fact, the entire state. I'd like to make a quick update on the data issues that we noted earlier this week. I mentioned the new case intake backlog that formed over the weekend when the number of new cases, new lab reports coming in exceeded the processing capacity of our staff, which works hard to verify that the positive lab reports are in fact new cases. We still have a backlog, but we're making steady progress on it, and the staff are working extra overtime and working very hard to get through the backlog as quickly as possible, and we are lining up additional staff in anticipation that these case levels may continue. Of course, we all hope that Minnesotans can help us slow down the growth of those case numbers so that not only our capacity to keep track, but more critically that of our healthcare workers and our hospitals won't be as strained as it has been recently. And on another data-related matter, we have resolved the issues that came up with the automated vaccination data system on Monday. As you might recall from our communication earlier in the week on that, approximately 7,000 people who received an initial mRNA dose of Pfizer or Moderna, followed by a J&J booster, were incorrectly removed from the count of fully vaccinated people due to an issue with our automated data process. Those 7,000 people will be added back into the online totals in tomorrow's data. Also, under our automatic process, a person with one dose of J&J was correctly counted as fully vaccinated. However, when they got a second booster dose of J&J, our system incorrectly categorized that booster as a second complete series. As a result, approximately 32,000 people who received a J&J booster on top of a primary J&J were counted as two separate instances of a complete vaccination series. This has now been fixed in the programming logic and will be updated on the public dashboard tomorrow at 11 a.m. I'd like to just make a note that these issues illustrate how seriously we take the accuracy and reliability of the data we're sharing and our commitment to transparency. We know many people are watching the pandemic numbers closely, and we want to give you all the most accurate and up-to-date information we can. And when we discover an error, we will tell you about it and fix it as quickly as possible. Moving on to another recent development with respect to the decompression sites that we've talked about, Governor Walz's directive that we do whatever we can to try to help take pressure off the hospitals by supporting long-term care facilities to take more of the hospital discharge patients that they typically would take. Governor Walz's office shared earlier today that we are opening today the addition of a second skilled nursing facility to act as an alternative care site as part of our efforts to help decompress Minnesota hospitals treating this COVID-19 surge. An additional emergency staffing team of 14 Minnesota National Guard members and 9 nurses from the Federal Public Health Services will treat patients at Good Samaritan Society Bethany in Brainerd beginning on Wednesday. This site will help to relieve hospital capacity specifically in central and northern Minnesota, and will have the capacity to accept 34 patients from area hospitals who are ready for hospital discharge but needing additional step-down care. The facility aims to take in patients who are eligible for transfer, and they don't any longer require acute emergency care, but they're not well enough to go home, such as those recovering from a surgery. Hospitals typically are able to transfer these patients to long-term care settings to continue their recovery and rehabilitation, but staffing shortages, which are particularly of concern in the long-term care industry, have really constrained the capacity for long-term care to take transfers as they typically do. Governor Walz announced an action plan last month to expand access to staffed long-term care beds so that hospitals can do those discharges and focus on treating the acutely ill patients that they are dealing with for COVID and other critical conditions. And with those updates, I'd like to turn it over to Chris Erzman to talk about the upcoming holidays.
Thank you, Commissioner.